World AIDS Day on the 1st of December 2021, the government through the Ministry of Health has pledged to make available the drugs by the end of January 2022. Elizabeth Atieno reports.
In April this year, Kenya experienced an acute shortage of the antiretroviral drugs ARVs, which hit public hospitals greatly, affecting people living with HIV and AIDS. Today, people living with HIV and AIDS have a reason to smile after the government announced plans to make the drug available by the end of January 2022. Through a press statement, Health Cabinet Secretary Mutahi Kagwe stated that the Ministry of Health yesterday held a meeting with representatives of people living with HIV and AIDS and came up with the following resolutions. That the government will expedite the commodities procurement process and have the commodities in 3 to 4 weeks, and that the government will explore local manufacturing for sustainable supply in future. On Monday, the National AIDS Control Council and the National Council for Population and Development released the latest data on the spread of HIV in Kenya, raising concerns over the spread of the virus, especially amongst teenagers.
We start politics of sexuality of adolescents. Today, if I stood here and tell you that countries that stop HIV give information and comprehensive information to their children about sex, you're going to condemn me and say that woman has said she wants to teach sex education to their children. But the reality is these children are there, they're having sex. So you must have different conversation as stakeholders, as media. How then do we package this information and ensure we are ending HIV among adolescents and young people? And this is the reason why our gains are very fragile. We make 5 steps forward and we go backwards because there's an animal in the room, and the animal is a child, is an adolescent. And this is the young people we must focus on.
From the latest data released by the National AIDS Control Council, counties from Nyanza region like Kisumu, Homa Bay, Siaya, Migori are leading. Other counties stated in the list are Busia, Mombasa, and Uasin Gishu. The National AIDS Control Council Chair Laibon further raised concerns over the high number of deaths recorded from persons living with HIV and AIDS.
Adolescents and young people having high HIV prevalence. This is not low for any country because it shows these children are being infected now. Are they dying? Yes, they are. For parents who have raised up a child living with HIV, one of the difficult conversations you have is to give that medication every day. And when they get to become a teenager and they decide that enough is enough, they don't want these drugs, then you end up losing them. So indeed, they are dying. And we have deaths related to AIDS and as high as 5,000. I know today when we hear 3,000 COVID deaths, we shudder. But we have figures for children we are losing as a result of AIDS. And this is what we must all think about.
However, Health Cabinet Secretary Mutahi Kagwe has highlighted that the country has made significant progress in the HIV response, where out of the 1.5 million people living with HIV, 1.2 million are currently on long-term life-saving ARVs. Elizabeth Atieno, TV 47.
Elsewhere,